So today we'll be discussing osteoporosis. Osteo refers to bones and porosis refers to pores. Osteoporosis is a condition where there is higher breakdown of bones than formation of new ones. This causes the bones to be porous and leads to decrease in bone density, making these bones susceptible to fracture. So a variety of things can actually cause this condition. I'm going to mention them in this video. Please stick with me to the end. This condition can be caused by genetics. That's if you have family history of osteoporosis, you have likelihood of getting it. It is also caused by depletion of hormones, like a hormonal change. For example, this is usually seen during menopause when there's depletion of estrogen. So osteoporosis can occur during menopause. Also, if you have deficiency in vitamin D, calcium, you consume alcohol excessively or smoke, there is likelihood of you developing osteoporosis. So symptoms may include back pain, loss of height, stooped posture, bone fractures, weakness in the muscle. So there are natural ways to treat osteoporosis. The first one is regular exercise. Regular exercise can actually help this condition. You can also use supplements. Yes, you can use supplements of like calcium, vitamin D, and omega-3 fatty acids too. Also, managing stress. You can do this by meditation or yoga. Maintaining a balanced diet rich in calcium and vitamin D can also help this condition. This leads us to the medical interventions or treatments available for people that have this condition. Before we get to the medical interventions, it is worthy to note that for maximum results, it is always advisable to combine these natural remedies with medical treatment for best results. Some of these medical interventions include use of bisphosphonates. What are bisphosphonates? These are synthetic compounds that inhibit breakdown of bone tissue. They also help to increase bone density. The second one is hormone replacement therapy. This is administration of hormones that are naturally not produced any longer by the body, like estrogen that I mentioned, that stops at menopause. So if you administer like estrogen, it actually helps with osteoporosis. Another medical intervention is selective estrogen receptor modulators. These are a class of drugs that act on estrogen receptors in the body. The last but not least is parathyroid hormone-related protein analogs. These are synthetic peptides that mimic natural occurring hormone involved in bone metabolism. Now, I also want to mention in this video that osteoporosis is a treatable condition. Your best bet is to combine the natural remedies with medical interventions I have mentioned. So if you have this condition or you experience symptoms that I mentioned earlier in this video, you should see your healthcare provider. I am sending you love and light, and I'll see you in my next video.